and welcome to the Student Health and Wellness Office at UConn. We understand that studying abroad is a thrilling experience, but it can also present unique challenges to your well-being. That's why our team is committed to providing a supportive and inclusive environment that promotes health and wellness for all students.
In this video presentation, we'll provide an overview of the services and resources available at the Student Health and Wellness, specifically tailored to meet the needs of our international students. Whether you're seeking routine medical care, mental health counseling, or assistance navigating the healthcare system in the United States, our dedicated staff is here to help.
We'll give you a glimpse into the compassionate and personalized care that you can expect when you visit SHaW's offices.
So sit back, relax, and let us show you how we can support your health and well-being during your time at UConn. At SHaW, we take a comprehensive approach to your care, considering all aspects of your health and well-being. Our team of experts from different fields, including doctors, nurses, mental health counselors, and other specialists, work collaboratively to provide you with the care that's best suited for your individual needs and concerns. We believe that by taking care of all aspects of your health, we can help you feel your best and achieve your goals here at UConn. SHaW has 3 different locations on the Storrs campus, including the Hilda May Williams building, where the majority of medical care and pharmacy services are offered, or on the 4th floor, where all of our clinical and mental health services take place, and in Wilson Hall, 1st floor, where our health promotion team is housed. Cultural Storehouse, which is home of the UConn recovery community. While we do important work at each of our 3 physical locations, we also provide outreach and education across campus. All of our SHaW nurses, providers, and clinicians have access to the language line, to which help with any concerns of a language barrier. This services provides access to over 200 languages and can be used during your appointments.
Medical services are available to all undergraduate and graduate students at the Storrs campus. Medical care includes physical exams, immunizations, injury exams, x-rays, blood work, reproductive and sexual health care, and more. An appointment must be made in advance for these services and to see a healthcare provider. There is also a 24/7 advice nurse that can be contacted for any questions or concerns students may have. We offer a variety of medical services to support your physical health and well-being. It's possible that our medical providers may suggest you stay overnight for additional care and treatment. If that is the case, our nursing staff will be with you and assist you with your medical needs. These medical services are available to all undergraduate and graduate students at Storrs campus. We offer a variety of medical services to support your physical health and well-being. The pharmacy is located on the lowest level of UConn Student Health. Pharmacists are available to fill prescriptions, and over-the-counter medication and medical supplies are available in the pharmacy. Curbside pickup is also available at the side door on the right-hand side of the building. SHaW's pharmacy is located in the Hilda May Williams building, is where you can pick up medications and medical supplies. A variety of mental health services are available for students as well. The first step is usually a screening done over the phone to understand which services would best suit your needs. Everything from crisis support to scheduled therapy appointments and psychiatric services are available for students. Our mental health services promote and fosters the emotional growth and well-being of all UConn students by providing a wide range of supportive services. The Circle Care model allows students to access a variety of individual and group-based services specific to their needs. Our health promotion team focuses on creating a culture of health and wellness at UConn through student engagement, innovation, and coalition building. They support our Wellness Coalition, which is a group of faculty and staff and students who facilitate conversation and joint action on health and wellness topics. The health promotion team also offers educational programming on priority topics for college students so that they feel empowered to take charge of their health and well-being.
The state of Connecticut requires that each student who attends the University of Connecticut is compliant with the required vaccinations. To fulfill the varicella requirements, you must have documentation of 2 doses of the varicella vaccine, one after your first birthday and one at least 28 days later, or documentation of disease incidents. If you believe you have received these vaccinations as a child but no longer have the documentation, you can have blood work done to verify your disease immunity. If you did not receive these vaccinations when you were a child, it is not too late to receive them now. You should receive your first dose as soon as possible. This would depend on appointment eligibility and when your insurance becomes active. For STORE students, an appointment can be made at Student Health and Wellness by calling 860-486-2719. Lastly, the tuberculosis risk assessment is required to be completed by every student. Based on assessment, further testing may be required. If testing is required, it must be done within 6 months of starting at UConn. This testing would include either quantiferon blood work or the PPD test. Meningococcal or MCV4 is required of any student living in campus-owned housing. This vaccination must have been administered within the last 5 years. These are examples of snapshots of what your compliance status is you will find when you log into your student health portal at myhealth.uconn.edu. The green check mark indicates that you are compliant with a particular requirement. The red check box indicates that you are not compliant with that particular requirement. The vaccinations in blue are recommended. If you are 17 years old or younger, you must upload a parental consent to your student health portal to receive services at Student Health and Wellness. To submit your health history information, you would first obtain a copy of your official immunization record from your primary care provider, then log into your student health portal. Next, you would select pending forms and complete your student health questionnaire, then upload your documents.
The United States does not have universal health care. SHaW uses a fee-for-service billing model. This means that all medical services have a cost, such as office visits with a provider for illness, injury, or physical exams, diagnostic imaging such as MRI and X-rays, immunization or vaccinations, laboratory tests such as STI testing and cholesterol screening. The cost of services is dependent on the insurance plan you are covered by. Without insurance, the full cost of the services will be your responsibility. With insurance, you may have a copay, co-insurance, or deductible. A copay is a fixed amount, for example, $20, that you pay for a covered medical service. Your insurance will pay the rest of the service fee. A deductible is a set amount of money, for example, $3,000, that you pay out of pocket before your insurance will pay for services. Co-insurance is a percentage, for example, 20%, that you pay once a deductible is met. Your insurance will pay the rest of the fee. UConn requires full-time students to be covered by medical insurance for the duration of their enrollment. To ensure this requirement is met, most full-time students are automatically enrolled in the Student Health Insurance Plan, SHIP. There are some academic programs that are exempt from automatic enrollment, so be sure to check your bill. Full-time is considered 12 credits for undergrads and 9 credits for grads. All undergrads are billed as full-time anticipated, even if they will be part-time. After the add drop period is over, which is the 10th day of classes, a process is run to identify less than full-time students, and the health insurance is automatically removed from the bill. Students enrolled in a minimum of 6 credits are eligible for enrollment in the Student Health Insurance Plan and can request voluntary enrollment. Graduate students are only charged for the health insurance if they are registered for 9 credits. If you choose to be covered by an alternative insurance plan instead of Student Health Insurance Plan, keep in mind that how much you pay for your plan can determine what is covered. Generally speaking, plans with lower monthly payments have higher deductibles and may limit covered services. Plans with high monthly premiums usually have lower deductibles or no deductibles. Some low-cost plans do not have coverage for preventative care, such as immunization and physical exams. It is important to know what services your plan will cover before deciding to purchase. If Students are covered by their health insurance plan. They can opt out of the student health insurance plan by submitting the health insurance waiver by the published deadline. Alternative insurance plans include plans you enroll in by yourself, such as Medicaid, Access Health, or exchange plans. You can also be covered by any insurance plans through your employer, your parents, or your spouse. It is important to review your term fee bill to verify that you were billed for the health insurance. The premium charge will be listed on your fee bill as its own line item called health insurance. It is not related to student health and wellness fee, which is a mandatory fee for STORE's campus students. Dependent family members of students should also be covered by health insurance while in the United States. Spouses and children can be enrolled in student health insurance plan. Contact SHaW for more information. Students who are enrolled in graduate assistants, research assistants, or teaching assistants, all referred to as GAs, will be eligible for health insurance through the Connecticut Partnership Plan, which is managed by HR or Human Resources. You have 31 days from your start date to enroll in the plan. The coverage will be effective on September 1st for those with start dates in August. The coverage will be effective on February 1st for GAs with a January start date. If you miss enrollment in the 31-day window, you will have to wait until the next open enrollment period, which is held in August. Dependent family members can also be enrolled in the coverage. All questions related to GA health insurance must be directed to HR at 860-486-3034 or benefits@uconn.edu. Alcohol EDU is an online interactive prevention program for college students that empowers students to make well-informed, safe decisions about alcohol in order to be successful at UConn. Even if you choose not to drink, you may be around others who drink. Alcohol EDU will provide you with information to support the UConn community. It's important to note that Alcohol EDU is mandatory for all incoming students. Not completing both Part 1 and Part 2 will affect class registration. You'll receive an email regarding Alcohol EDU that will go to your UConn email address, which includes instructions. Please be aware that Part 1 must be completed on time in order for Part 2 to open 45 days later. There is an immovable intercession between Part 1 and Part 2, so completing Part 1 on time is what sets you up to be able to complete Part 2 by its respective deadline.
If you have any questions or concerns about Alcohol EDU, we encourage you to check out our frequently asked questions page or email alcoholedu@uconn.edu for assistance.
If you ever have questions about your health requirements or your insurance, reach out to the SHaW Business Office and SHaW Health Information Management at the following emails.
Adjusting to a new culture and country is not entirely linear, and everyone experiences differently. It can be a cycle where people start at different places. The honeymoon stage typically includes feeling excited, optimistic about school and your new life. The anxiety stage is associated with feeling overwhelmed by a new environment, possibly returning and feeling unhappy, anxious, confused, or isolated, where people are missing people and the familiar things such as food and language. Adjustment or negotiation stage is when you begin to gain understanding of the new culture and not feeling as lost, getting more familiar with the environment while at the same time reconnecting with what you value about yourself and about your own culture. The acceptance stage is when you begin to settle into the realization that the new culture has both good and bad things to offer in gaining a more solid sense of belonging. It's important to prioritize yourself as you're managing this transition. Keeping in contact with your family and friends, having familiar and meaningful things with you can be very supportive during this transition. At the same time, consider engaging in new experiences in the community, allowing you to participate in new activities and meet new people.
The Student Health and Wellness Mental Health Team includes a team of licensed practitioners who deliver a range of services. This graphic outlines the various ways a student may interact with the mental health team. Starting with the wellness resources, which comes in the form of mindfulness and yoga, and online self-directed resources that students can access.
Let's Talk is an informal consultation appointment with a clinician. This is a great option for students who may need some quick advice or want to better understand the counseling experience. We also offer consultation available to staff, faculty, parents, and other students who may be concerned about a student and want to talk with a clinician. We offer two primary treatment modalities: group treatment, which offers students the opportunity to address issues commonly experienced by college students in a confidential, supportive manner. Individual treatment is a brief, solution-focused, student-centered approach focused on current life circumstances. Medication management is also available for students needing psychotropic medication. Crisis support provides clinical assessment for urgent or emergent mental health issues and is available 24/7, 365, whether you are on campus, off campus, an international student, at home, or studying abroad. Clinical case management works closely with students who are stepping down from a higher level of care, are in need of specialized treatment, or who may have long-term treatment needs.
Welcome to UConn!